Penny called me up, and she was the first person who, instead of asking me questions about my son's death, she asked me questions about his life. And she was truly interested in who he was, and she seemed so genuine. She came out to the house, and for 2 hours we just talked about Red. This is Red. Suddenly I felt like I wasn't alone. She kind of held my hand. She was going to get me through this. She was going to walk me through this. She was committed to helping us, working with us, educating us about SIDS. She was able to kind of steer me in a path where I wasn't blaming myself anymore, and I was able to really start healing when I let go of the guilt. So I'm very grateful for Penny, because I think I would have been in that dark place forever if she hadn't have come in and helped me through it. So she's been kind of my angel in all of this.
Well, my name is Penny Stastny. I'm a public health nurse, and I have coordinated SIDS for Orange County and LA County for over 3 decades. We, as public health nurses, can make a huge impact in the follow-up for SIDS families that lose a baby so suddenly, unexpectedly, and without explanation. And for the record, as I discuss about SIDS and the SIDS public health nurses, I am referring to all of those babies that die from sudden, unexpected infant death, sudden death in infancy, undetermined, and even unknown. That is very important as nurses go out, because so much of our literature is still with SIDS, and we need to understand that it's also sudden unexpected infant death or undetermined. The primary reason and purpose nurses need to be making home visits is to take away the blame and the guilt that they feel when their baby dies. And as many years as I've been doing home visits, this ends up being the main issue and problem. SIDS parents need us. And if I can share with you the materials that we've developed and used that you can read, gain knowledge, education, and go in equipped, then you can make a successful home visit. And I can tell you that parents will remember you forever. They need help, and they need us nurses helping them. Supporting SIDS Family, the public health nurse home visit. The article is a how-to tool for nurses going into the home. I've written it in such a way that nurses can read it, and if they've never made a home visit before, they can go in and know pretty much how to make this visit. This is the second document that I believe will make the difference for any nurse, new nurse, seasoned nurse, as she goes out and makes a home visit to SIDS families. The reason I say this is that it is filled with information not only on SIDS research, but on the impact for parents in the grieving process. It's very important that these parents understand the triple risk model, because it takes it away from the circumstances, and all of a sudden it says there are 3 things involved. Do risk factors cause death? No. They increase the baby's likelihood that they might die, but they do not cause the death. Differentiating between risk factors and the cause is huge. Once we receive the call from the coroner's office, we in turn need to respond immediately to these families. We don't know what their needs are, and we can't assess what their needs are unless we make contact with them. And I've heard nurses saying, well, we know that they've got family support or somebody else. But I'm here to tell you that family may not have the answers that public health nurses have in terms of SIDS knowledge and even support. And we need to be more diligent about making those phone calls and convincing, and I mean convincing, it's like a sales job. We are here and we can make a difference for you and helping you take away that blame and that guilt and help provide support to you. We need to persevere and be very diligent about following up with these families. It's important that we start establishing a relationship, calling a baby by his or her name, seeing the pictures, and letting these parents know that we really, really care and that we are there with a mission to really help connect and make a difference and help them through their healing process. It is a new normal. We know that it isn't a recovery per se process, but that they do go through this journey. And we as nurses have such an opportunity to make a huge difference. A very important point for SIDS coordinators when they're making the visit and working with the families is to connect them with another SIDS parent. If there's no support group in the area, there is nothing like a new SIDS mom being connected with a SIDS mom that maybe it's been a year or 2 or 3. It allows the new mom to see that there is light at the end of the tunnel, that there is hope, and that they can make it through this devastating time.
Child loss is such an isolating feeling, and you feel so alone even in your relationship. You know, there's nothing that can be said or done to fix it. So I think as a father, it's your natural instinct to want to fix something that's wrong or broken. And SIDS is a burden that you have to carry for the rest of your life. You can't fix it. It's just a weight that kind of carries on you. And by having a good public health nurse like Penny that really cares and is helpful, I think that's been dramatic for us and our healing.